Hello and welcome to this special event, our 6th online Frontline Club briefing. I'm Naomi Steer, the National Director at Australia for UNHCR. I'd like to start by acknowledging the traditional owners of lands right around Australia, and I pay my respects to elders past, present and emerging. And thank you to all our supporters across Australia and beyond for joining us. And I want to say a special hello, I guess, and message of support to our colleagues and friends in Victoria. We know you're in another lockdown. We feel for you, but we're very glad that you've been able to join us for this webinar. So thank you and good wishes to everybody from everyone here in Australia for UNHCR and colleagues in UNHCR also. This afternoon's webinar is a first for the Frontline Club, as well as giving you direct access to our UNHCR colleagues who are waiting patiently to join me and who are leading the humanitarian efforts in Yemen. You will also be embarking on a virtual mission. Please don't log off after we've been on our journey together, as we have our special guests from UNHCR who of course will share more insights and information about the situation in Yemen and how we can help. Welcome to our guests, Jean-Nicolas Beuze, UNHCR's current, and I shouldn't say current country representative. I don't think there's any plan to change you as far as any of us know. Welcome again to Australia's for UNHCR's Frontline Club, Jean-Nicolas. And Dr. Samira Banware, Senior Public Health Associate, UNHCR Yemen. Our Frontline Club is about connecting our supporters, whether in person or online or around Australia, with those in the field, giving us a chance to hear firsthand what's happening on the ground. Yemen has been described as the world's worst humanitarian crisis. After 6 years of conflict, more than 20 million people need humanitarian assistance, and that's a little less than Australia's population, as we know. More than 16 million people will go hungry this year. That's an extraordinary number. And our most urgent task is to prevent widespread famine on a scale we haven't seen for 40 years. And that's the term that humanitarian organisations are describing the situation there. Compounding this crisis is the ever-present threat of communicable diseases, cholera, but of course also the COVID-19 pandemic. Yemen's economy has disintegrated and the country's health infrastructure has been badly damaged. I'm not going to talk in details. I've got some numbers here, but I know Jean-Nicolas and Samira will be sharing that situation firsthand with us. Women and children are the most vulnerable. 1 in 4 displaced families is headed by a woman or a young girl. That's a really, really large and astounding number. Despite the ongoing conflict, Yemen continues to host over 100,000 refugees and asylum seekers who are dependent on UNHCR for support. We're going to find out more about the complexity of that situation in Yemen, how UNHCR is responding. I'm very pleased, in addition to Jean-Nicolas, that Samira has joined us, and I will introduce you further after the virtual mission, because there's so much to share, particularly about what positive steps UNHCR and its partners can take around health interventions and other kind of interventions to support both the host population and refugees. So if everyone's ready, we're going to start our virtual mission, and I'll see you shortly.
Jean-Nicolas, the former UNHCR representative in Canada from 2017 and 19. I'm now here in Yemen, in Sana'a, where UNHCR, the UN Refugee Agency, assists the internally displaced by the conflict, as well as 230,000 Somali refugees. As I speak to you from Sana'a in Yemen, the conflict is raging. displacing scores of families who lose everything because of the shelling, the fighting, the bombing. This is why UNHCR, the UN Refugee Agency, is on the forefront of the response in Yemen. We provide shelter, we provide psychological support for those who have been harmed and who are traumatized by years of conflict and displacement. We provide cash assistance so that people can pay their rent, buy food or medicine for their elderly parents. Without you, we will not be able to be here and continue saving lives. We can do more, but we need you.
How much do you know about Yemen? You probably heard it's on the brink of famine and is the world's worst humanitarian crisis. But what do you really know about what's going on in Yemen beyond the headlines? Did you know that Yemen was once called Arabia Felix? It means lucky or happy Arabia. My name is Warda and I work for the UN Refugee Agency. I'm here today to talk to you about Yemen, and I'll be speaking to my colleague Noor, who's been living there since she was 6 years old. So tell me, what was it like growing up in Yemen?
Well, despite living through the conflict throughout my life, believe it or not, I have happy memories growing up as a child here. My favorite memory was my father taking us to Bab el-Yemen, where we used to walk through the old city. Imagine there was once a live orchestra there, and there were many tourists. And did you know that mocha coffee originates from Yemen?
The situation in Yemen is often cited as the world's worst humanitarian crisis. But why? There's ongoing conflict, cholera outbreak, floods, COVID-19, and now the country's on the brink of famine. But before we go into details, let's get some basic facts straight. Yemen is a country in the Middle East. It lies at the southern tip of the Arabian Peninsula. Its population, 30.8 million people. 20 million of them require humanitarian assistance. That's 66% of the entire population of Yemen. That's more than the combined populations of Sweden, Norway, and Finland. So why are so many people in need of help?
Well, Yemen has been in and out of conflict and political instability since the 1960s. I remember, for example, in 1994, there was a civil war between the North and the South. But in 2015, for example, the situation was different because the conflict turned into a full-blown war.
In all these wars, thousands of Yemenis have died and around 4 million have been forced to flee their homes. In fact, today, 1 in 8 Yemenis are displaced.
My house, where I lived with my son and my parents, was bombed twice. In 2015 and then in the end of 2017, we were forced to move into a different neighborhood. We consider ourselves really lucky to be able to afford to move.
These repeated conflicts left a huge dent in Yemen's economy and infrastructure. Hospitals, residential buildings, schools, and roads were all affected. They also led to acute shortage of food and medical supplies. People in Yemen struggle to buy food for their families, and some can't even afford to sleep on a mattress.
What's striking in Yemen is that it's a young population with more than 7.4 million children caught up in the conflict. My childhood in Yemen was challenging because of all the problems, fuel crisis, and electric cuts.
So we talked about the conflict in Yemen, but sadly, it's not the only thing wreaking havoc in the country. In the last few years, Yemen witnessed the largest cholera outbreak in modern history, but only 50% of health facilities are functional. So what are humanitarian organizations doing about this? The humanitarian operation in Yemen is the largest in the world. The largest, yet it's severely underfunded. In 2020, funding shortages forced aid agencies to shut some of their critical and life-saving programs in Yemen. UNHCR too had to prioritize and support only the most vulnerable displaced families, leaving millions without assistance.
Today, I would like to invite you on a tour for you to better understand what is the situation of those Yemeni families who have been affected by 6 years of conflict. The conflict continues killing and maiming children, women, but is also displacing 1 out of 8 Yemeni, and UNHCR, the UN Refugee Agency, is there to assist them through different interventions. So come with me on this tour.
المال اللي كان معانا دفعناه للمواصلات. دخلنا في المكان هذا اللي احنا متواجدين الآن فيه، وقام أصحاب الخير بإنقاذنا بالمعونات من البيوت. رمضان كنا في الحديدة سبحان الله نتهيأ من قبل وصوله، أما الآن فلا نقدر نستقبل رمضان إلا بالصلاة والصيام فقط. أتخيل إن شاء الله في أقرب وقت ندخل بيوتنا حتى لو كانت مخربة نبنيها، بس أهم حاجة نجد الأمان والاستقرار.
As you see, the houses here are very, very rough because of the tropical weather and environmental changes. The houses are usually made of rags, old plastic sheets, trees, and other items, which does not protect rain and the cold weather or rough weather from the inhabitants living in this site. Here is one, this house is, houses a family, IDP family. Assalamu alaikum.
عليكم السلام، تفضلوا وأهلا وسهلا.
Okay. She welcomes us to see her house, and of course we are going to listen her situation. ممكن تتكلمي معنا تعرفينا بيتكم يعني كيف يعني كيف تعيشوا ايش
تمام. هذا معي بنتين خيام، دي أول خيمة زوجي راح داخلها.
She accepts to introduce her house and give us around. Her husband is sleeping inside. She has got 2 tents provided by UNHCR, and the other one.
هذه الخيمة الثاني.
And
بنتين خيام، وأنا معي 3 بنات.
second tent is a makeshift يعني which they could build to have a rest.
معي 3 بنات اللي ممكن كبيرة عمرها 7.
She has got 3 daughters. The eldest is 7 years old.
كبيرة عمرها 7 والثاني عمرها 2.
The second is 2 years old.
أتكلم هنا كطبخاني.
She cooks her food in this kitchen. Here is the family kitchen.
أطبخاني هنا.
Okay, what do you ايش تطبخي؟
أطبخ خضار، لا في معي رز لا في.
كم مرة تطبخي؟ She cooks rice. She cooks prepared food at least once a day.
باليوم مرة إنه ما فيش معانا عمل، ما فيش عندنا دخل السبب إنه مرض فرد كورونا.
مرة واحدة تطبخوا؟
باليوم مرة واحدة.
Once a day she cooks because of economic problem,
هنا صبن.
unemployment, so because of corona. She also washes her clothes here, the family clothes here.
هنا صبن أنا في أبي في عيالي وفي زوجي ونبذل المحل.
And her husband is clothes here, her clothes here. She washes.
ذاك زوجي هناك راقد ما فيش معه عمل.
And her husband is now living inside the tent because he is unemployed. He does not have any job. ليش؟ ليش ما في عمل؟
ما فيش عمل، ما فيش إنه عندهم داخل
She says unemployment. Her husband is unemployed because of the corona. He has got this motorcycle. He used to work it at the market to give a ride to the people in exchange of few Yemen reals. But because of corona, all the public interaction is now down, she says. The little daughter, Ranger, is a 5-year-old. She helps her mother to provide, to fetch the water from the tank. The main tank is somehow 10, 15 meters away from the shelter. تشربوا من هذا التانكي. The little daughter says they drink water from the tank. How كم دب تقدر تملي كل يوم؟ So she says she is able to fill up about 10, 5, 4 small containers of water a day to support her mother. أتدرسي أنت مدرسة؟ أيوة. صف كم؟ ثاني. She goes to the school and she is in the 2nd class primary school. So she provides water to the family. This is the history of 24 million people in Yemen. The conflict has affected almost every person in the country. Needs are massive. What we wanted the world to know is the situation people are living here and what action we are going to take in this situation.
6 years of conflict in Yemen means that all the basic services have been missing. Behind me you can see the garbage. Many Yemeni do not have access anymore to running water, to electricity, or to education or health facilities. But still, as you can see behind me, children, like anywhere in the world, continue playing. And we hope that through your support, we can do more for the children of Yemen. We cannot abandon Yemen now. They are on the brink of famine. There's a raging conflict which is killing, maiming and displacing population, and we need more of your support to continue helping the new generation of Yemen for one day the possibility for them to rebuild their country and build their own resilience. Thanks to your support, UNHCR, the UN Refugee Agency, has been able to help millions of Yemeni. We have provided shelter for those who fled their home due to the fighting. We have provided cash to help the families survive. We have helped families to get access to medical care. Without you, we will not be able to be here and continue saving lives. So today, on behalf of UNHCR, I wanted to thank you from the bottom of my heart for not having forgotten the Yemeni. Thank you.
Well, thank you for that, and welcome back everybody who's able to join us online. It's a very salutary experience when you see that, and particularly when you see, you know, what I guess Yemen had before the conflict and the possibility of Yemen. And I saw some discussion in our chat, you know, from some of our friends who've joined us today about traveling in Yemen and the beauty of Yemen. But 2 decades later, how that's all changed. Before we start, just a reminder, if you do have questions, and I can see some of you are already being very active, so thank you very much. Please type them up in the chat function. We will have time to answer as many as we can. And as you can see, Jean-Nicolas has already been getting into it and engaging. So thank you, Jean-Nicolas, not being shy or retiring, and we really appreciate that. Yeah. So I'm going to start off first with you, Jean-Nicolas. We spoke almost a year ago when we had our first webinar on Yemen, which seems like a lifetime ago, but also in some ways not that long ago, because I think sort of COVID for all of us has sort of made time a very sort of compressed experience. But can you describe, we've seen some of those images, we've heard some of those facts, but what is the situation today in Yemen? And have things changed for the better or the worse or in any way over the last year since we last spoke?
Good afternoon, Naomi, and good afternoon to all our friends and supporters in Australia. You don't know how much your presence on this seminar counts for Samira, Dr. Samira, and myself, to know that we have your support. So unfortunately, now, Naomi, the situation has been spiraling down into further misery. I mean, Len mentioned that she had been visiting the country 20 years ago, and as you said, the country had only been going down great. Over the last year, what we have seen is really the socioeconomic impact of the coronavirus. And I'm sorry for all the friends in Victoria who have to be in a lockdown, but imagine being in Yemen. You cannot go on a lockdown because basically the money you make during the day is what brings food to the table in the evening. As you have heard on the video, I've met, and Samira has met many families who mentioned that they eat only once a day, and if they get lucky. I met a mother who really broke my heart because she said that she has to send her kids to beg on the street around the mosque in particular to get money. And in the afternoon, with the money that she gets from the kids, she can feed the kids. But what really is behind this story is that she said that every morning her heart as a mother breaks because she doesn't know whether the kids will come back. They live very close to a front line, and she says there may be a stray bullet, there may be a landmine. I have no choice but to send my kids so that we can eat, but I'm making them take a risk. So that's the situation a year after we met. Desperation, risk of famine, looming famine on approximately half of the displaced families, and we are here to help. And with your support, because there was also a question about how Australian can support, and we'll come to that. With your support, I assure you, we can make a difference. We are not going to return back to 20 years ago, but we are going to help people to survive with a bit more of dignity.
Yes, yes. And you've mentioned famine, and that's quite a technical term in the way that the UN declares it. Has famine actually been declared? But also, what is the general situation? And I think also explain to us what it actually means and the reasons for it and the factors that are contributing to that, because it's quite complex, really, isn't it?
It's indeed a very complex situation, and we don't like the UN call a situation famine because it means that it's a completely desperate situation. It also means that we have forgotten the people who are facing the famine. So there's a sense of lack of responsibility towards our fellow human beings. So we are very cautious about speaking about famine. The situation is in Yemen that we have 5 million out of the 30 million, so it's 1% out of 6, who is on the verge of falling into famine, meaning not enough food to be able to sustain their living. That means lifelong consequences for the children. If you don't eat enough between the time you are born and the age of 5, we know that there will be development consequences on your brain, on your body, and so on and so forth. So it's long-term consequences for 1 out of 6 Yemeni. In concrete, it means people don't eat more than once a day. Yeah. And what they eat is mainly a bit of bread, a bit of rice. If they are lucky, they get a bit of tea with sugar, but they don't get any of the nutritional elements such as vegetables, fruit, certainly not milk, certainly not meat. And so we have 1 out of 6 Yemeni within this situation of having dire consequences. The worst case is that they die from hunger. The worst situation of famine is that, and it will be in particular children, lactating or pregnant women who have more needs in terms of food intake, but also elderly and persons with disabilities who are the most at risk, and among them the displaced population, which are under UNHCR mandate, who are the most at risk of really having these dire consequences of dying from hunger.
Yes. Now I'm going to come to Samira in a few minutes, because I want you, Samira, to talk about, the actual health interventions and go through the process of how you actually address malnutrition and some of these issues. But staying with you, Jean-Nicolas, for the moment, in the sort of bigger picture, we've seen in that virtual mission enormous needs, displacement, treating health concerns, availability of water. We've just discussed famine. What are the key priorities for UNHCR moving forward?
So the main line of intervention, and I must say I'm extremely proud of my team on the ground, is our cash assistance program. It means that through the money that we receive, for example, from Australians, we can directly give 97% of the donation directly in the pocket of those families, of the women, the children that you have seen. And with this money, they are able to choose what are their priorities. So it does not become our priorities as us, UNHCR. We help those families to decide for themselves what are the priorities. But what do they tell us? They tell us that, first of all, they use money to buy food. It's obvious. We are in a risk of famine. They use our cash that we get through support from many donors, including private individuals like Australian with us today. They use it to buy food. The second thing, which is also very obvious, is that they want to have a roof above their head. So they will pay a bit of rent, or they will buy a plastic sheet, or we will help them to put a plastic sheet in. You have seen the living conditions. They are appalling living conditions. But if you don't have a roof above your head, you are subject to the element, but you are also in a very patriarchal society. You expose your women and girls to the eyes of others. And that is very complicated in a society like Yemen, because you want to protect the privacy. We know that. We all have a house, and we are quite happy sometimes to close the door and not to see our neighbors and our family. It's the same for Yemeni. And with our cash assistance, which is one of the biggest cash assistance programs of UNHCR globally, we are changing the life of those people.
Yes, thank you. Samira, we've just had a sort of great explanation about cash assistance, which is a sort of key and relatively new intervention, I think, for all humanitarian organisations, including UNHCR. But in the health sector, which is your area, what are some of the key things that you are leading in Yemen?
UNHCR in Yemen, we are leading in some emergency intervention. Particularly for health sector. Our intervention is very limited, but as Jean-Nicolas mentioned, that cash-based assistance is also, part of it is also used for treatment or for medication. The currency instability and the increased rate of decreased rate of reals is affecting the community a lot. Both IDPs, vulnerable. They make vulnerable people more vulnerable. On top of that, the infrastructure, which is most of it destroyed, and also lead to appearance of epidemics in most of areas of Yemen. We have been seeing that cholera is one of the major epidemic in Yemen, and on top of that, we also have malaria, dengue, and also chikungunya. All of these, and also because of the destruction of the weakness of health programs. Part of it is like a routine immunization program, and with the conflicts now appearing the child illnesses, diphtheria cases, measles cases, they're all now on top. And this also affected the already present malnutrition of under 5 children. So this is lead to increased mortality rate and morbidity among children under 5. UNHCR is doing, as I mentioned, is doing limited assistance, and more obvious now with the COVID-19 situation. UNHCR having clinics and supported clinics, and also we supported the Yemeni isolation centers with equipment, with PPEs, and also with IBC, infection prevention control materials. That was the major assistance from UNHCR. As mentioned by Jean-Nicolas, is the effect of children is not only health or malnutrition. You see in the video that children is fetching water, so this is putting children under risk. Also, this lead also to the conflict lead to appearance of harmful tradition that was almost disappearing in the past. Is like early marriage, because people want to cope, want to get rid of the young girls, and using the money from their marriage to cope with the family.
And I imagine, you know, just if we go back to the video we just watched, and, you know, the woman, her husband, her child, you know, as you said, the child, sort of the daughter having so much responsibility, gathering the water, and, you know, all the protection and safety issues around that. Mum looking like she's having to do everything. Dad probably very depressed, really, not being able to work and provide for the family. So a lot of trauma and psychosocial issues on top of the physical issues that are sort of clearly there also.
Yes, you can imagine the trauma that these children face, and the risk that these children are going to beg. So they face sexual abuse, sexual harassment. There is a lot of cases.
Yes, and with 1 in 6 women, I think that was the statistic of, you know, and young girls, heads of households. And again, the vulnerability of women, and you've mentioned some of the potentials of sort of exploitation, early child marriage, and many other things. Can you talk very specifically about what programs we have in place to support women and young girls in this situation in Yemen?
Okay, as I mentioned that rental subsidies, providing shelters, these things can help a woman-headed household to get some dignity and to get mild protection at least. Also, we have community-based, we have community centers that receive and we help the women with the psychosocial support, and yeah.
Yes, and I've got a question in sort of around this. Obviously, UNHCR isn't doing all this itself, and it's working with partners. But what is the local capacity, the national capacity of sort of government or local administrations or services to help with any of these support, the support that's needed?
Maybe
yes, go ahead, please.
Sorry, Samia, I interrupted you. We have a country which is divided into 2, the north and the south. So for UNHCR already as a starting point, we have to deal with 2 different sets of authorities. The capacity of the government is very limited because, as Dr. Samira mentioned, half of the health facilities have been destroyed. A number of doctors and nurses have left the country. Like in any of those crises, if you have an opportunity, you go out. But what UNHCR does, which is really important, is that we act through our national civil society partners. Very localized organization who are the one who are ears and eyes on the ground, who are the one doing the needs assessment, who are the one doing the referral of the most vulnerable cases, like if they discover a family who is headed by a woman, or family where there is many children with disability, or an elderly person who is on her own because she got separated from a family. Those NGOs, those national partners, civil society organizations are in the front line and help UNHCR to know what is happening and respond in a very culturally appropriate manner to the needs of the people. But sorry, Samira, you wanted to add something.
Yes, as I mentioned, the government struggling also to do some programs in to address and to face such problems, but it's never enough. And the continuous instability in the country is the major cause of such problems. As mentioned by Jean-Nicolas, that UNHCR is doing limited assistance as possible through the national partner. Yeah.
And Samira, you have
one point I just wanted to add to it's not only the health facilities destruction, it's also the cadre, the health workers themselves. Most of the health workers are either left, the best qualified health workers either left the country, and we left with a very, very limited, very small number of specialists to deal with all these medical problems. In addition to that, the cadres are not well paid, and the salaries, they didn't receive salaries for few months. They went into a lot of strikes, so sometimes even emergency departments in hospitals, they went in strikes. So they left people either to go to private hospitals or to go home and die.
Yes, and Samira, you yourself have a very extensive experience in public health, and over 14 years, as I understand, working both with UNHCR and other NGOs in Yemen, and you know, very, very qualified. But as somebody who's born in Yemen, educated in Yemen, brought up your family in Yemen, how do you see the prospects for your country as it stands now?
As a Yemeni personnel, a Yemeni female, I am a single parent of 4 kids, and I struggle with, as a woman in Yemen, I struggle a lot since birth of my children. I have 3 daughters, and I start fighting against cultural and bad tradition. One of them is FGM. I fight a lot for my daughters not to get FGM, and to get my daughters to complete their education and to grown up and choose their life. It's also very difficult for me. I lived all my life. I struggle a lot as a Yemeni personnel, and also within the conflict, the conflict, my house is destroyed, partially destroyed, and my family, my family have to displace into another governorate, which is very difficult and traumatic. We stay for almost 1 year and come back to my partially destructed house and start all over again with maintenance and you know, with the daily sufferance of shortage of fuel, electricity cut off in a very hot area, also internet and you know, connection very, very weak. But with all of that, I said thanks to God. At least I have all my family together. I didn't lose a beloved one. But when I looked around me, I saw my neighbors is losing their beloved children, either in mines, in the conflict, if not with the diseases. It has been time that a lot of houses around us is having one person dead, either from chikungunya, from malaria, from COVID-19.
Yes, thank you, thank you. Just Jean-Nicolas, I saw you answering a question there, and somebody had asked around budget and funds and how much do we need. I am going to ask you to repeat your answer that you've included in the chat for the wider audience, and then I've got some more questions from both our supporters and myself to ask.
Yeah, but thank you, Naomi. First, I really would like to praise Dr. Samia for sharing this personal element. It's the situation of most of my Yemeni colleagues here. And I think it's very striking to see that the UNHCR colleagues are in the front line to help others, but they're also in a very difficult situation with the electricity cut, with the displacement, with being a single mother, and even all those issues. And therefore, it's absolutely critical that we continue getting support, including through funding, for us to be able to not only support the displaced families, but give a meaningful professional realization for all those colleagues who are dedicating really their life to help others. So let me go back to the funding. We are almost half of the year, and we have only received 30% of our funding, which means that we cannot assist all the people that we have identified as in need of our support, whether it's a cash intervention for them to buy food or medicine, whether it's to provide an emergency shelter once their home has been destroyed by the conflict, for them not to live under the tree in the open. It's about providing healthcare to refugees. We have 140,000 Somali and Ethiopian refugees who have found temporary asylum in a country like Yemen. They entirely depend on us for their survival. They are discriminated, they don't have access to jobs, they don't have access to public services, whether it's health, education, shelter. They entirely depend on us. So with only 30% of the funding, you imagine that each time we identify 10 people we need to help, we can help only 3. And we have to abandon 7. That's the reality. That's the reality that Dr. Samia and myself have to do every day. Prioritizing for the most vulnerable, knowing that we should help others, but that we don't have the means.
Yes, thank you, thank you. Jean-Nicolas, we've spoken about the humanitarian situation, but I also wanted to talk about the broader political situation, global situation, because when we're looking at long-term solutions, obviously both Australia for UNHCR, our supporters, UNHCR, we're all doing our best to deal with that day-to-day basic survival needs of people there. But how do you see the long-term scenarios? And particularly, I guess we have a change of government in the US now. I'm not going to go into too much around the specifics, but I would like your views about how you see the wider context, the prospects for peace, and what role UNHCR has in that process.
Yeah, I mean, there's a lot of hope with the change of the U.S. administration, because you know that the U.S. has a strong influence in the Middle East, and especially in Yemen, because they support the coalition led by Saudi Arabia, which is fighting against the Houthi, who have taken the north of the country and who are in the capital, Sana'a. So the US administration is really pushing with the United Nations, the parties to the conflict to the negotiating table. And there's different elements of this conflict. There's an international one. I mentioned the Saudi-led coalition with the support of the US, but there's also a dimension which is much more domestic. So we need to really keep in mind that even if we solve the international aspect of this conflict, which is the intention of the US, The new administration has clearly said that they want peace in Yemen. They want a negotiated peace agreement. They want to lift the embargo. A lot of problem in terms of electricity, in terms of fuel shortage, in terms of the food prices which are going up are linked to the embargo. There's an embargo on the north of Yemen, which means that everything which is imported has to get all kind of clearance, and as a result, the prices are going up. But what is important to keep in mind is that once we resolve this regional, international aspect of the conflict, there's still a domestic dimension. And Samira is in Aden in the south. I am in Sana'a in the north. The two parts of the countries do not necessarily see eye to eye in terms of the future of the country. Politically, we have different opinion about how Yemen should be managed in the future. So we are here in the long term. We are, UNHCR, the UN Refugee Agency, is here to stay in Yemen, unfortunately. It's not going to be a quick fix. And that's what is absolutely critical to think when we speak about our level of funding, for example. Because if we don't help the Yemeni now, given that it will take years to stabilize completely the conflict, the country, this process, we are really pushing people heads under the water. And it will be far more difficult in the years to come for us to take them out of the water again. What I want to say is that really Yemen needs our attention now. If we wait a little bit too long, as Dr. Samira mentioned, we are going to lose a full generation of children, traumatized, not having had a healthy development because not eating enough, not being able to go to school, probably a large number of them being maimed by landmines, by stray bullets and so on. So a lot of disability. I worked in the disability movement in the past, and I'm really taken aback each time I go to the field by the number of persons with disabilities that I meet. I'm also taken aback by all those elderly persons displaced who are going to end their life without any dignity. Yes, imagine yes. You have done everything for your family, and then you are separated by the conflict. Your own family cannot reach out to you, cannot help you, and you die on your own. I know that now it's much more visible in our Western society with COVID-19, very unfortunately. But this has been for years and years the daily reality of the Yemeni people.
Yes, yes, yes. So difficult. You've touched on COVID-19, and I want to come back to that with Samira because we've spoken about some of the support that UNHCR is providing, PPE and whatever. And obviously, you know, globally and in Australia, it's so top of mind, not only prevention and treatment, but now the vaccination rollout. What's happening in Yemen in terms of being included in universal vaccinations, and how's that going to apply to both the host population and the and refugees?
Yemen received the vaccines, the first batch of vaccines, and they made priority for vaccination of health workers and frontline humanitarian workers, people over 60, and people with chronic illnesses. The vaccinated started in late April, and it's continued. And honestly, there is as global happening, there is a lot of rumors, and there is a lot of people who are afraid of the vaccine and they don't want. Healthcare providers started to accept the vaccines, and the Minister of Health is trying to encourage them to have the vaccines. The coverage of vaccines slightly improving now with times. Refugees are accepted to take the vaccines. UNHCR made advocacy with the government of Yemen, and as we know, government of Yemen was too generous to accept refugees similar as Yemenis. So we started also now vaccination in the camp. Yesterday started vaccination in the camp, but as others, there is a lot of rumors and rejections, but we are making awareness campaign, and trying to reach as much as we can with the vaccine.
It's interesting though, isn't it? Shared humanity. And I'm sure many listening today would know in Australia, there are mixed views about the vaccination too. And, you know, obviously some people who fear it, some who don't, some who can't wait to get it. But it's really important, that sort of public confidence, isn't it? And, you know, it's very good news that people do have access, because I think many of us here would think, you know, it was very unlikely. For UNHCR globally, and I don't know if either you or Jean-Nicolas can talk about this, because I think universal vaccinations is a really important issue, and UNHCR has been part globally of the Gavi initiative, and very involved in advocacy together with the UN Secretary General about the importance of getting universal vaccinations. Can either of you talk about that bigger picture policy from UNHCR and the importance of that?
Just to kickstart the response, Naomi, and you are entirely right. We have been really, the UN as a family has been really promoting universal vaccination on various fronts. But I don't want to be too pessimistic, but we have received only 300,000 doses of vaccine in Yemen, in a country of 30 million. So it's really a drop in the ocean. We really hope, and I think this is something that some of the followers today of this seminar may want to take up. We need more vaccine being dedicated from the Western countries when there are surplus, for example, to be dedicated to countries like Yemen. Because 300,000 vaccines for a country of 30 million, that's not going to help a lot. Yes, it's making a difference for the frontline health workers, but it's not going to help a lot of in the population. So what we are really trying to do now is addressing the non-health aspect of the COVID-19. And I think it's really important to remember, in a country like Yemeni, people don't have insurance. They don't get money in the bank or under the mattresses to be able to survive if for a few days they cannot go to work or they cannot seek livelihood opportunities. So for us, UNHCR, our main, because health is part of our response, especially with the refugees, and we are really doing our best, but we are overwhelmed by the needs. What we really try to do is making sure that the coronavirus pandemic does not push even further people into poverty. And it's absolutely critical. You cannot imagine the level of poverty that have been increased due to the coronavirus. But we, for those of you who have contact with politicians and so on, yes, please help us on two fronts, I would say. Help us get more support from Western countries in getting more vaccine doses. We absolutely need them. We absolutely need them for me to protect a colleague like Dr. Samira, for her to get vaccinated, because we don't even have enough doses for our own staff or for our own colleagues, for their families as well. Because Dr. Samira goes every day or every other day to health facilities, so she's in contact and exposed to the coronavirus like all of my colleagues, because that's our job, to be with people, to listen to people, to try to help people. And we are not going to stop that, because that's our mission. And we are very dedicated to do that. But I need also to protect my colleagues, therefore we need more doses. And the second point I wanted to say, Naomi, to come back on what Australian can do, your earlier question, is that of course, if you can provide funding for those who can, please help us, because your money will be well spent in Yemen. I assure you, Samira is my witness. We are going to do the best we can with your money. But maybe some of you cannot afford to give to UNHCR, and we fully understand that. The COVID-19 has also hit many Australian families, but you can call for your government to do more on the peace process, because without a resolution of the conflict, everything that we can do here in Yemen will be temporary, will be a band-aid on an open wound. What the Yemeni people need is peace. And what we need in Australia, in the US, you were mentioning the change of the administration, is really a push by everyone for peace to be resumed in Yemen.
Yes, and thank you so much for that, because as you might see, some of our supporters have asked exactly that. How can I help beyond funds? You know, I'm either already supporting, or, you know, I don't have the funds, but I really want to help. And I think that that message about advocacy to our own government, both in terms of, you know, continuing to support in their own right humanitarian assistance, not just from the private sector, but, you know, through the, you know, international forums, you know, supporting a peace process, but also very practically supporting universal vaccinations with funding towards that are all really important things. I think that we also, through Australia for UNHCR, hope we will have a voice with government and our supporters for that. Just a reminder, we've only got a few minutes. Questions are live. You can't all see the chat, but the questions that I'm asking are coming through now. They're not pre-organized, and we are trying to get as many of them or the themes up. So please, if there's the burning question that you need in the last 2 minutes, there is one, and I do think it's an interesting, and then we've touched on it, you know, the capacity, the local capacity of government and the local administration. Given the instability, in practical terms, how does UNHCR interact with local or authorities? How does that actually happen?
It happens both in Sana'a with the Houthis, the de facto authorities who have taken over the northern part of the country, and in Aden, which is the internationally recognized government, the former government which was in Sana'a, but who took refuge in Aden when the fighting started. On all fronts, we liaise with the Ministry of Public Health in terms of trying to convince them, for example, to accept the refugees in the public health facilities. We speak with the Ministry of Education to make sure that refugee children, for example, are included in the public school. For that, we give some incentive to the public institution to receive the refugees. We may help on the salary of the civil servants. Dr. Samira mentioned it's something absolutely tragic, but most of the teachers, most of the nurses and the doctors have not been paid for years, and they still go every morning to school to teach children. So UNHCR tries to compensate a little bit the loss of the salaries, because the authorities have no fund, have no budget, by helping the payment of those salaries. We may refurbish some from school, provide separated latrine for girls and boys in some school. We have done some rehabilitation with Dr. Samira. She took me to Basatin in Aden, some rehabilitation of clinic where a woman comes for prenatal consultation, or where they deliver their baby. So it's all part of reinforcing the public institution to deliver services, not only for refugees, not only for Yemeni displaced, but for the general population. And I assure you, it's very much needed. Yes.
Well, look, I'm sure you'll agree with me, Jean-Nicolas. I must give the last word to Dr. Samira. And I would like to ask you, Dr. Samira, and again, I also echo Jean-Nicolas, thanks for sharing your personal experience, because that gives us such an insight, but it's also, we're quite sort of privileged to have that. But thank you so much. But what are your hopes for the future and the next generation of Yemenis?
My hopes for next generation, number one is peace. Number two is peace. Number three is peace. After peace, everything will come. Yeah, and I hope that the next generations will take care of the country after getting peace. Education will improve. Everything will improve, inshallah.
Inshallah, indeed. Thank you so much. Shukran, I should say, to both you and Jean-Nicolas. And thank you so much for our supporters. It's been, again, such a fascinating and informative discussion, but a really motivating one, which I all think we feel after this. We have our checklist of things that we can do. But if you do want to find out more as a supporter, how you can help, both in terms of donations or other kinds of support, please come to our website, unrefugees.org.au. Meanwhile, we look forward to everybody joining us at our next Frontline Club event. Thank you for standing with refugees, and thank you again so much to our colleagues in Yemen who are doing such fantastic work under incredibly difficult and challenging circumstances. We really salute you and thank you for that. Thank you, Jean-Nicolas and Dr. Samira. Thank you.